Dystrophies are diseases characterized by muscle weakness, usually caused by the death of myocytes. There are a few different types. Duchenne and Becker muscular dystrophies are both caused by a mutation in the same gene, called dystrophin. The dystrophin protein is cytoplasmic, but is part of a larger multi-protein complex that anchors the cytoskeleton of the skeletal and cardiac muscle to the extracellular matrix through the membrane. It also happens to be the longest known human gene, which means that just through sheer probability, it's also the most likely to get spontaneous mutations. If dystrophin is defective, it can cause membrane abnormalities that screw up calcium homeostasis and eventually cause cell death through necrosis. Dead cells will eventually be replaced by fat, which you can see in this image. Now, dystrophin is on the X chromosome, so who do you think is more likely to get it, males or females? That would be males, and in fact, it's extraordinarily rare for females to get this. Okay, so what's the difference between Duchenne and Becker? Well, first of all, Duchenne is more common, although both of them are pretty rare. Duchenne affects 1 in 3,600 boys, and Becker affects 1 in 18,000. Duchenne is also more serious. So these are both caused by mutations in the same gene, so how come one is more serious than the other? This is because some mutations have a greater effect on the final protein. So Duchenne is usually caused by a frameshift mutation which truncates the protein, which makes it completely non-functional. It's usually first noticeable before the age of 5 and results in loss of ambulation by around age 10 and death in their late teens or early 20s. It's a very serious disease. So what do these patients die from? Usually dilated cardiomyopathy. Becker is both less common and less serious than Duchenne, and is caused by a less functional dystrophin protein rather than a non-functional protein. It's not caused by a frameshift mutation, but usually a missense mutation. The onset is a bit later, usually during adolescence or early adulthood. After this, it varies a lot from person to person, but some may have trouble climbing stairs by the time they turn 20 and die by the age of 40, and others may lead a relatively normal life, except that they might need a cane when they get old. In both Duchenne and Becker, the calf muscles are particularly affected, and if you ever see or hear of a patient with pseudohypertrophy of the calf muscles, think of these diseases, because this pseudohypertrophy is caused by the fibrofatty replacement of muscle tissue, which is what you're seeing in this image. You should also associate with these with the disability to perform a Gower maneuver, especially Duchenne, since it's more serious. This is trying to stand up from a sitting position without using your arms, and the inability to do this is usually due to muscular dystrophy. Diagnosis can also be made by looking for increased creatine phosphokinase in serum, or by doing a muscle biopsy to look for fibrofatty replacement. Another type of muscular dystrophy is called myotonic type 1 muscular dystrophy. This one is pretty rare, kind of like Becker, but it's not related to the dystrophin gene. Rather, it's caused by a trinucleotide repeat of the sequence CTG in the gene DMPK, which stands for dystrophia myotonica protein kinase. Some genetic terms that fit this disease are pleiotropy and variable expressivity. Do you remember what those mean? Basically, you can have a lot of different phenotypes or symptoms, and it differs a lot from one person to the next. You want to suspect this in somebody who walks into your clinic and has obvious muscle wasting, like they're just skin and bones, and maybe when you shake their hand, they seem to have trouble letting go for a couple seconds. What's that called? This is myotonia, which is where the name myotonic type 1 comes from. Myotonia is basically delayed relaxation of the muscles after voluntary contraction. So anyway, those are the biggest things to look out for, but these people will also have cataracts and balding, and are more likely to get cardiac arrhythmias. Patients with this disease don't often die from it, or at least not until they get very old, but if they do die from it, it's usually because of the cardiac effects, and these patients will often end up having a pacemaker put in at some point during their life.